Hi, I'm Josh Parker from Parker Hearing Institute, and I'd like to take a moment just to explain what you would expect on a first-time hearing visit. What we do is we're going to sit down, and after you've made your appointment, we'd expect the appointment to last between 30 and 45 minutes. And this time you're going to come in, and we have some basic information that we need from you to start. The normal stuff that you'd fill out at a doctor's office. But then we sit down and we need to have a conversation about what your real problems are. We need to know what sort of hearing problems you may be having, if you've had a history of ear surgery, if people in your family have had ear problems. And we want to go over again that history. Many people have some sort of noise exposure, history of middle ear problems that they may have been seeing other doctors for. But most people that come to us are coming to us because they have voids or gaps in their conversations where they really just don't hear people well. Those voids are usually caused by some sort of hearing loss. The hearing test will consist of a brief evaluation of the ears to make sure there's no obstructions, wax, or other debris inside the ear canal. We'll put some headphones on and we start measuring how quietly you hear different tones. We want to measure how clearly you understand speech when it's at a level that we know you should be able to understand clearly. We have some middle ear tests that we'll use to make sure that there's no pathway issues or medical causes to a hearing loss. After that evaluation, we sit down and we go over the results. We should be able to explain why any sort of hearing loss creates those voids that we had communication-wise, and what kind of recommendations we can come, whether it's off to see another physician for treatment, whether it is improving the way that you listen, or in some cases, the use of hearing aids to help correct for those hearing losses. We hope to see you soon. Josh Parker from Parker Hearing. Thank you.